Good morning, everyone. Today we have a 30-year-old male patient who is posted for open reduction internal fixation of the humerus and plating of the ulna, as he has a mid-shaft humerus fracture and a distal ulna fracture. The patient is positioned for a supraclavicular block with head turned to the opposite side, shoulder lowered and elbow flexed over the abdomen. Proper positioning is important as proper visualization of the nerve bundles can be seen. Supraclavicular block is one of the most commonly used for surgeries involving the upper limb, and the ultrasound, when available, should be used for any block as it helps to directly visualize the nerve bundles and prevents any inadvertent vascular punctures and limits the dose of local anesthetic. Skin is disinfected and draping is done. Transducer was wrapped in a sterile gloving and placed in the transverse plane. The artery is now seen as an anechoic black structure, and the pleura and first rib is seen as linear hyperechoic structures. It is important to see all these three structures in one line. The plexus, as you can see, is seen as a bunch of hypoechoic round grape-like appearance just next to the artery. At this level, upper, middle, and the lower trunks are seen. The needle is advanced in a lateral to medial direction. Be careful to maintain visualization of the needle at all times. Piercing the sheath is important before drug placement and can be felt as a pop. After aspiration, 1 to 2 ml of normal saline is used for hydrodissection and confirmation of local anesthetic of needle placement. After that, aspiration, local anesthetic propivacane 0.5% was used along with dexmedetomidine 1 microgram per kg diluted up to a total volume of 30 ml. First, the drug is placed just beneath the artery, and the artery can be seen as lifting off or being pushed away from the plexus. After placement of around 10 ml, around 5 to 7 ml just beneath the artery, and maintaining needle vision again, the needle is repositioned and is directed towards the upper trunk just above the artery, and drug is deposited inside the sheath. This technique allows all the three trunks of the brachial plexus to be blocked, but always be careful to aspirate before giving the drug as needle is very close to the artery and may be displaced easily. Supraclavicular block is very commonly used for surgeries involving the upper limb. It can be used either independently, where it is specifically beneficial if the patient is not a suitable candidate for general anesthesia, and administration of sedative hypnotics can be avoided. It can also be used as an adjunct to general anesthesia for pain relief intraoperatively as well as postoperatively, such as in procedures involving the proximal humerus and the shoulder. As we can see, needle is now being deposited. The drug is now being deposited near the upper trunk, and the structures, when the drug is deposited, structures can be seen as separating. Around total of 15 ml was given in the supraclavicular block. Now we are placing the probe, just tracing the probe just upwards from the supraclavicular view into the neck until we visualize the two scalene muscles, the anterior scalene and the medial scalene muscles. These two muscles are easily visualized when we trace it upwards, and in between the two muscles, we can see the uh, three hypoechoic structures, which look like a stoplight or a traffic light sign. The needle is advanced under proper visualization. The sheath, the muscle is pierced, and we're advancing the needle towards the three bundles. After careful aspiration, 1 to 2 ml of normal saline is used for hydrodissection and to confirm that the needle is properly placed. Now we are giving 0.5% of ropivacaine. Around 10 to 15 ml can be used for this to spread the local anesthetic around the block, around the plexus. As we can see, the upper and the middle are very nicely visualized here. Ultrasound is a very important tool, especially for interscalene block. Careful monitoring and careful monitoring of the patient should be performed, as respiratory compromise can occur in patients with a severe pre-existing respiratory disease due to blockade of the phrenic nerve at this level, and patient may have symptoms of dyspnea. As we can see, the drug is now being injected in the lower part of the trunk. Interscalene block is very effective when used as an adjunct, and it blocks the shoulder region. As we can see, the surgery was performed successfully, and we did not need to give any sedative or hypnotic. Oxygen mask was used to provide supplemental oxygen, and the patient remained pain free post operatively for around 6 hours.